Welcome back to The Physician's Mind, where we talk with the most driven minds in medicine about success, mindset, and mastery. Today's guest is Dr. Sean Altman, with a powerful story of discipline, focus, and relentless pursuit of excellence. You're going to take away real lessons on what it means to rise, lead, and win in this field. And if you want to start building connections like this on your own, check out my free mini course, White Coat Connections, at www.thephysiciansmind.com. It'll show you exactly how to build the kind of network that accelerates your career. Let's get into it. Dr. Altman, how are you, sir? Thank you for joining me.
But it's a pleasure to be on. Thank you so much.
Absolutely. So can you just tell us a little bit about who you are and where you're at in life right now?
Sure. So I'm an orthopedic expert, functional medicine doctor, and really my specialty is non-surgical options for pain management and really finding ways for patients to heal their pain. It's a very much root cause approach. I've developed it over many years that, it has been a sort of a combination of various colleagues, professionals, people I've worked with, learned from, as well as, quite a bit of coursework.
Excellent. And you're at a successful point now. Can you share with us what is it that you did early in your career that most physicians maybe don't think to do? What is it that has made all the difference in your journey?
So honestly, I think what has made the biggest difference is that this has been, to a large extent, a personal journey. So when I was in school, I dealt with my own chronic pain. I had a history of Lyme disease, fibromyalgia, a lot of injuries from ice hockey, some concussions. In my study of medicine, obviously I found a number of people who were qualified, at least I thought, to deal with it. And I realized that the traditional model really didn't have any answers. Concussions don't show up on imaging. So they can't find anything to treat. Fibromyalgia, there's no objective clinical test for it. So, I was basically given, anti-inflammatories, pain medication, and very little help. And ultimately it didn't really help much at all. So that really catalyzed this personal journey in terms of looking into other forms of treatment, other modalities, really looking for the root cause of why I was still in pain, why I was still struggling. And then, that really just jump-started this lifelong pursuit of medical knowledge, understanding, information, systems-based treatment that I've developed over the years.
Excellent, sir. And can you share with us what systems or principles have helped you build a successful and profitable practice? Can you share the journey on that?
Sure. From a success standpoint, I've really identified four key systems to look at, and that is structure, chemistry, nervous system, and energy. And when you look at those systems, each of them is very important in terms of maintaining biomechanics, full movement and keeping a person out of pain. Structure meaning stability, mobility, biomechanics, chemistry being, laboratory testing and making sure that there aren't nutritional imbalances, metabolic issues, issues like that. Nervous system being the balance between sympathetic, parasympathetic, which is essential for healing anything. If we are upregulated sympathetically, we can't heal an injury and we also can't heal illness. Our immune system becomes subdued. The last of which is energy, and that's, energy as it pertains to like mitochondrial activity. Mitochondria is kind of the big word these days. People are all into it, but not everyone knows exactly what it means. So, mitochondrial energy means having sufficient energy, but then your body systems on a chemical level being able to process that energy. So we do investigatory mitochondrial testing. There's this test called mitoswab or mitome, and you can actually assess for both mitochondrial activity as well as absorption and how effectively your mitochondria are working. I use the analogy of a car and gasoline being the energy. Well, having enough gas in the tank doesn't mean that it's using it appropriately. What if the engine is using gas inefficiently? What if the car's leaking oil? Or leaking gas, these things are important to pick up on because otherwise you're just chasing the symptoms. And that's really the biggest, issue I see in modern medicine. is that it's very symptom based, and we're just trying to like figure out how do we get rid of this symptom or this symptom, not chasing what it's coming from, and what systems might be affecting it.
Very interesting. So, an emphasis on preventative care using four tenets of structure, chemistry, nervous system, and energy. And I like the car analogy. I've thought of it as well. Like, we only get one car, so you kind of want to take as best care of it as possible. That's excellent, sir. So, before we dive in deeper to your private practice experience and your work, can you share your thoughts on what separates a good clinician from a great one in today's medical world? It's a very competitive field.
Absolutely. So the good clinicians are, they're strong academically. They excel in classes, but they're tied to the algorithms and the treatment approaches that they're taught. They don't, a great clinician looks for the pattern behind the problem, looks really detail into the diagnostic part, and looks for upstream, downstream relationships between body systems. So this scientific rigor, that's really what is at the root of these great clinicians. And it really helps you to improve your clinical excellence faster to approach it that way. Because, it's no different than like studying in school. If you are studying particular subjects and trying to master that subject, understand the full depth and breadth of it, it's very different than trying to memorize certain pieces of material. Because now that those pieces of material, they don't really fit within a larger schema. So it's seeing these as large concepts, looking for patterns, looking for connections, and they will inevitably come if you look for them.
Okay. And do you think it's important for the modern, either young medical student resident or early attending physician to be thinking like an entrepreneur? What is the value in thinking like an entrepreneur, and how can a physician start thinking like one?
So yeah, that's something I wish I had done earlier. In terms of my career, is looking at the financial aspects of it. So as an early student resident, working your way through school, obviously your emphasis is on mastery. It's on learning the skills, learning the information, but I would highly recommend finding excellent mentors to work with, to learn from, to learn the business aspect of how the practice works, how insurance reimbursement works, if you're going to go insurance versus cash base, just seeing the financial dimension to it. Because until you see that part of the picture, you're really not in a place to start your own practice, to go cash based, any of those things. So, the best thing to do is try to really learn from them. I remember when I realized I needed to learn this, my on entry into that was, some of my supervisors, I offered to help them with financial tasks, data entry, stuff like that. And they were, of course, very open to that because I'm doing work for them. But by doing that, I also saw the numbers, the profit and loss, how the business worked, what overhead looked like, and it's a great opportunity to do it then. It's better to learn it before you're actually taking on those risks and in the trying to do it all at once.
Excellent. Yeah, that is a good way to put it. Find the mentorship and just break it down piece by piece. Do you have any thoughts, rather, if you had to start from square one on everything that you've built, what would you do first?
I would really emphasize that the entrepreneurial part. I would start finding mentors earlier on to understand the financial side of it. I was able to get some tutelage, some information, but I did feel like I was somewhat unprepared when I went into practice for myself, and some of it was kind of like learn on the go. And it wasn't bad. I learned to learn from my mistakes, and that's probably the best piece of advice I could give to any medical professional, is to view failures as opportunities to learn, not as abject failures. But I believe I could have prevented some of those by really focusing earlier on learning the business, the entrepreneurship, the financial aspects of a practice, and of ultimately being successful financially in medicine.
Absolutely. And on the topic of finance, what do you think are some of the biggest financial mistakes that most physicians make when they're first starting out?
I think the biggest mistakes is that they take on too much overhead right away. Going after a large scale office, top of the line equipment, all the things that maybe they had in their prior practice, but didn't realize that that prior practice took years to bring in all of that stuff. Lean and mean is really the best way. So, you start with the essentials. Obviously you need to be able to have the space and the treatment modalities and such, but not necessarily over investing in everything right away. And, I like to use the term like reinvest in the business. So, I started lean, and as I became successful, as I started to do better financially, I added pieces of equipment, or I traded in, lesser pieces of equipment for an upgraded model. And that's a really smart way as a business to operate, and also like you think of it like tax wise, you're able to deduct and you're able to, minimize the taxes you have to pay by buying more equipment as opposed to taking a higher pay. But these are things that you learn over time, and as I said, it's best to learn when you're in the context of a practice that's being run and you're not running it. And this way, once you're in that position, you feel adequately prepared, and you understand how these things work.
That's great. Yeah, start out lean and mean. Thank you, sir. So, when you are a physician, you have a medical degree, you have the credibility, and that certainly helps market your skill. But in your work, can you share with us how you're measuring and marketing your results instead of just your credentials and your ability to treat, and why that's so important?
Absolutely. So a number of ways. I mean, the most basic one is patient testimonials. So I've video recordings of patient experiences, people that I've helped. Especially like significant success stories where other treatments had failed. And then that's able to be shared with others. Obviously that feeds into things like word of mouth. And such. And then I track data. So I have, one of the biggest things that I would say really changed my career trajectory was musculoskeletal ultrasound. So with all of my patients, I track via imaging their progress. I use ultrasound to confirm diagnosis, and then I will re-image them every 2 to 4 weeks to confirm healing, to monitor stages of healing, and now I have objective photographic evidence of them getting better. That is indisputable. I have brochures, things like that I can show and say, look, this is what someone was at day one, and this is what they were 6 weeks later. And then the last one, this is a biggie that some people will learn about sooner than later. There's a fantastic data collection resource called Data Biologics, and we use it for collection of data for various treatments, and that includes everything from range of motion to functional outcome measures. And there are thousands of providers who participate in it. So it's a great way to like collect high level research data. It tracks outcomes, it creates charts based on age, demographic, all that. You can see how you're doing, and then you can see how other professionals are doing. That can certainly help to create some popularity as well. If other people on there see the types of outcomes I'm getting, they're like, oh wow, this guy, he's doing really well. We should probably, refer to him, or, catch up with him, create a meeting, something like that.
Excellent. Yeah, sounds like three fantastic systems. Are there any other clinical skills or modalities that you found that deliver massive results for patients but are perhaps underutilized in modern medicine?
Sure. So the two major ones that I use that are gaining popularity but probably not used as enough are shockwave therapy and laser therapy. Extracorporeal shockwave therapy is basically using sound waves to create cavitations in the cells. It induces a little bit of microtrauma, and what that does is it brings growth factors and blood flow and cellular activity to the area, and it provides energy, a tremendous amount of energy to the area. It can be tremendously successful in treating many different orthopedic injuries, nerve issues, anything from rotator cuff tendinopathy to neuropathy. There's a lot of ground that it can cover, and the technology has gotten more and more advanced over the years. And the second one is laser therapy, and I'm talking about high intensity laser therapy. So In lasers, we have class one, two, three, four, and then anything above a class four would be called a cutting laser. So those are lasers used for surgical procedures. So I use therapeutic lasers, and those lasers are class four, but they're pulse, so they're able to deliver a lot of energy to an area without generating any heat. And I've seen some just absolutely remarkable results with that. It's starting to gain popularity. A lot of the orthopedists who do regenerative medicine, like I do, are starting to use it more because they realize how dramatically it accelerates and improves their outcomes. A colleague of mine just published a study on lasers where his PRP outcomes went from 78% effective to 99% effective with the introduction of laser therapy. And here's the even bigger part of that study. Healing rates for those patients with the laser were an average of 2 to 3 times faster.
Hmm.
And when we think about it scientifically, it makes a lot of sense. If we are adding an additional signal to the PRP and providing requisite energy, that allows the body to respond to it a lot faster. And it also makes sure that it's getting the right message.
Very interesting. Very interesting. I'll be sure to link that paper in the description for any of you listeners who are interested in learning more about that. But a couple interesting pieces of technology, shockwave and laser therapy, something that definitely isn't utilized in mainstream medicine, I would imagine. So that's very cool, and it sounds very beneficial too. And now, Dr. Altman, I'm curious, in the clinical setting, when you have 15 minutes with a patient, what's your process for building trust and loyalty with that patient in such a short period of time, or do you spend more time with them?
So now that I'm on my own, I do spend more time with them. I spend an average of 60 to 90 minutes with each patient. I'm able to do that because I'm in a cash-based setting and I can scale my rates accordingly. But I did work in insurance-based, and I had, days where I was treating 30, 40 patients a day, and it's very, very hard to condense all of that clinical thinking and really give a top quality treatment in a 15-minute period. So with that, I had to be creative. The pattern recognition is very helpful because it helps accelerate your clinical decision making. And looking back now, I don't see that as a bad time. It's kind of just a reality of working in insurance-based medicine. I see it more as like a boot camp, really challenging you clinically, academically, intellectually to think faster on your feet, to make decisions faster. But you really need to find the extra time to evaluate those decisions, to figure out when you're making mistakes because of the rushed pattern. And ultimately, I do think, if you have a passion like this, like I do, for really top-notch care, being an elite clinician, you have to find a way, you have to find the means to get more time for evaluations, for treatments, in order to get better outcomes. But it's certainly not, it has not been an easy path, and it isn't an easy path, but it's valuable. I had this company that I worked with at one point where I was seeing very high volume of patients, and I had my annual review with their vice president and regional director of operations, and they point blank told me that, quote, my biggest weakness was that I care too much about my patients. They said I needed to see more patients and make more money. And it was at that moment that I realized I had to get out of the insurance game. I had to figure out a way that I could have an office and the autonomy to do just that, to care more about my patients, to spend enough time with them to really figure out what's going on and how to truly, truly help them.
Wow. Yeah, that's incredible that they would say something like that to you. That's a testament to the state of medicine today. What are your thoughts then for a physician who wants to explore this cash-based or independent practice? Where should they start?
So you have to start on the insurance end. You have to find the right mentors, get in the repetitions, get the practice in, get that clinical thinking, decision making speed up, and learn the finances behind it, learn the entrepreneurship areas, learn how the structure of an office works before you jump into your own. And then even, when I moved out onto my own, I work in interdisciplinary offices. I still try to surround myself with people of different backgrounds, different skill sets, to continue my learning and my growth. I think, I have colleagues who are chiropractors, and many of them good friends of mine, but when you have a solo office where you're the only person there, it stunts your growth. You just basically, you'll reach a maximum of your potential, and then, unless you are driven to go to lots of courses, then you really, like, you reach a level and you're stuck at that level. So I'm a big believer in, networking, continuing to have connections with other professionals, reading the research, and trying to advance and, become more proficient with each month, each year.
Excellent. Yeah, absolutely. Just start out understanding the system and then go from there. Excellent. Now, back to the patient interaction. Dr. Altman, when you're working with a patient, what is it that your treatment plan does to get real results and truly identify the cause of the pain instead of just treating the symptoms?
So I look at those four systems, but then we do very detailed analysis of their entire history. And, I can't say enough how important it is to get a detailed patient history and really listen to the patient, because sometimes the slightest little detail will pop out that, like, helps you figure out what the source of their symptoms are. And it's not always on the intake form. In fact, most of the time it's not on the intake form. I can recall a patient recently, with a history of headaches and migraines, and it turned out she had upper cervical instability. And initially, we couldn't figure out why she had that. She didn't have any history of car accidents, falls, concussions, all that she was aware of. And then, the second time she came in, she was like, I was talking to my mom, and I didn't remember. It turned out when I was 12, I fell in the playground, split my head open, had a massive concussion, was knocked out, So yeah, light bulb, like, we figured out what was coming from. But it was because I planted that seed in terms of what we were looking for, and then we were able to find it. And that works for patient history, and often it can also work for lab testing. You have to know what tests to run, what to look for. Unfortunately, in today's day and age, some of the tests are not covered by insurance. But sometimes you need that test to confirm a diagnosis, or to figure out exactly what is going on. So that's where, yeah, you have to be very transparent with patients. And really, I emphasize this, like, team concept that, I try to empower the patient and say, listen, we are trying to solve this problem together. It's not me, it's me and you. We're doing this as a team, and I want you to be actively involved in your care. And when you do that, then you get much more patient engagement, better compliance, and ultimately better outcomes.
Amazing, amazing. Once you've reached the diagnosis, then can you share your process on getting that high performance treatment plan? What does that look like?
So once we come up with a diagnosis and what's driving that diagnosis, what the root cause of it is, then I have accumulated multiple modalities over the years, like laser, shockwave, FSM, PNE, and I try to tailor my treatment to that source, that cause. And by creating that effect and by addressing it head on, we're able to get the person to heal themselves, to get themselves better a lot faster, and to really complete the process. And my skill set is, obviously, it's neurologic, it's orthopedic, but it doesn't cover everything. So another, like, really good, tip I can give in medicine is recognizing when something is outside of your skill set. So there could be a condition or an issue that doesn't fall in your specialty, and that's where networking really pays off, knowing the right people to connect the patient with so that they can get the full, complete treatment that they need. I have worked very tirelessly and very hard to try to be able to be the person who can solve most problems, but I can't do everything. No one can. So I'm stealing this from a colleague of mine, but he said this at the beginning of a patient evaluation, and it'll always stick with me. So this patient came in with history of fibromyalgia, chronic illness, pain everywhere, dysautonomia, just a lot of issues. And he looked at her and he said, listen, we're going to go through your history. I'm going to evaluate everything. And I don't know that I'm going to be able to figure out everything that's wrong with you today, but I'm going to look for the answer and I know how to find it.
Motivate.
And that really stuck with me because it points to, humility, admitting that you don't know everything, but shows how driven you are as a clinician and how important that person is, that we're gonna find that answer. And that's really what I try to do with all of my patients, where either I will find the answer and I have the tools to help them, or if it's something outside of my skill set, I will find them the appropriate professional to see to get the treatment that they need.
Excellent. Yeah, that drive is so inspiring, and it emphasizes as well the importance of networking because sometimes you reach your limit of understanding or knowledge or expertise, and you need to outsource some of that knowledge to a colleague. And emphasizing, yes, the importance of networking, not only for your career development, but also for the care of your patients. Listeners, if you want
and
to pick
and it's and it's
skills.
really helpful also just from a referral standpoint and a business standpoint, creating good referral networks where you're sending patients to them, they're going to send patients back to you. It's win-win, and it shows how much you respect their expertise, and then they'll ultimately respect what you have to offer.
Well said. Well said. Now, what do you think on the topic of learning from other physicians? What do you think some everyday patients, or not patients rather, but doctors can learn from your approach to care and treatment plan development, etc.?
I would say just looking at those various systems individually, analyzing them entirely, getting the complete patient history, really making sure that you see that big picture before you jump to any conclusions. Modern medicine is very hung up on diagnostic codes, labeling, but the reality is that, lumbar radiculopathy does not tell you what the cause of it is. It just describes the pain. It's just a way of medically describing it. What we need to figure out is, why do you have radiating pain from your back down your leg? What is the source of that? It's a nerve, but is it arthritis? Is it stenosis? Is it a bulging or herniated disc? Is it peripheral nerve compression? That's the important part, is figuring out the why.
Absolutely. So, transitioning to some of your personal mentalities, what are some daily habits or disciplines that have kept you at the high level in the field over the past 15 years that you've been working plus?
So in my exploration of like my own personal treatment, I've instituted things in my own life like grounding exercises, breath work for nervous system regulation. I'm on a consistent strength and mobility and cardiovascular exercise program where I do weight training several days a week. I do cardiovascular exercise. And I think it's important for all of us to do it, because you have to be healthy in order to help others get healthy, and it really is a classic thing with medical providers that we can become kind of martyrs where we put all of our work, all of our energy into treating others, and we forget to take care of ourselves. So you really need to have that balance. The other things I do are I track metrics with wearables. Like I have an Apple Watch and a Fitbit. Probably will get an Aura at some point. But I track my heart rate variability, sleep quality, things like that, just to make sure that things are in the appropriate levels, and try to optimize them through healthy habits.
Awesome. Yeah, 100% doctors do need to set the example. It is a shame when, you see a physician sacrificing their own health and well-being at the expense of their, well, rather in order to succeed with their patients and their learning, etc. But you're right, doctors need to set the example.
And some of that has to do with the system, unfortunately. When you are being forced to see 50 patients a day and you have no time for paperwork and you have no time to eat, you have no time to drink, you're just being pushed to your limit, you really don't have much time for self-care. So you have to find the time, and then ultimately, when you can, find a way out, find a way to get into a position where you can have that work-life balance, where your life also is important. And it's not just about pushing numbers and making money. And it's been tough. I've had a number of colleagues, who, there are a number of physicians nowadays that have left clinical practice entirely because they just can't handle the pressure, the stress, like the high volumes, and they've gone, with like these clinical consulting jobs or chief medical officer things, which I guess works for them if they're happy with that, but they've lost the ability to practice, which is it's terrible. Especially some of them were superb clinicians, and the system basically just pushed them out. They became depressed and poor sleep, and they came to this crossing point where they're like, I can't do this anymore.
Right. Yeah, it's absolutely real and prevalent in today's society. But it goes to show that your story, it shows us that it is possible. But I actually just had a conversation with a pediatrician with a private practice in California in the last episode, talking to him about his private practice journey. I mean, is it realistic for a new physician to be able to generate and build a private practice? I mean, there's a lot of incorporate or rather incorporation of medical care that we're seeing today. What do you think, it's hopeful?
I think it's possible, but I think it's hard, and it's certainly not getting easier. So that's why I would say the biggest thing to do is to learn about this early on, um, you know, and I would wait till you're maybe a few years out of residency to start looking into starting your own practice, because you can't just do it out of the gate. There's too much to learn. There's more to the back end of everything than meets the eye. And we don't get good business training, so you really have to learn those things, understand how it works, be prepared mentally, physically, financially to do it, because sometimes it takes quite a while to just even break even with an office. So you don't want to create undue stress either.
Right. And do you have a piece of advice that you would give to a medical student or a resident who wants to become wealthy and respected and fulfilled in medicine?
I would say, to maintain the passion, to chase mastery, not money, to solve meaningful problems that no one else can solve, to find your niche, to find where you can really shine and to build on that.
Amazing. Well, Dr. Altman, it's been a great conversation so far, sir. I want to leave you with one final question. What does excellence mean to you, and how can young professionals apply that standard in their own career?
So I think excellence really revolves around three things: precision, accountability, and evolution. So precision is having the appropriate diagnostics, treatment plans, treatment advances, staying up to date, really mastering your craft and continuing to master it. Accountability goes back to what we were talking about before, where mistakes happen. They happen a lot less the more masterful you get, the better you are at recognizing patterns. But to be accountable, to take it, take responsibility for those mistakes, learn from them, advance, like make you stronger. Vince Lombardi, famous NFL coach, had this saying that I really love. He used to say, adversity doesn't reveal character. Sorry, adversity doesn't define character, it reveals it. And that's really what happens is, when we start to see more and more challenging patients, or just even more patients in general, is there's going to be some adversity. You're going to have cases you can't solve right away, and it's how you learn from it that helps drive your development. And then finally, evolution, the learning from these mistakes, learning from mentors, learning courses, just constantly evolving your approach and your care is really going to lead to excellence in the field, and continuing to do it. I am by no means stopping. I think I've gotten to a good point where I have, a method and systems in place that work very well, but I'm still refining it and I'm still advancing it, and I'm still staying up to date on newer treatment approaches, newer things that are coming out. This year, this is not new to the world, but it's new to America. I've helped four patients heal from complete ACL tears non-operatively
Wow.
using this cross-bracing approach, which they've been doing for about 10 to 15 years in Europe. So just realizing, that across the pond, there's other things going on. Like, I try to learn from everyone, not just in America, from around the world, and look into a bigger pool.
Amazing. Amazing. Yeah, and I'll definitely link some literature in the description for anybody who's interested in that too. That sounds really interesting, and I want to read up on that. But awesome. Precision, accountability, and evolution. That is a great definition of excellence. Dr. Altman, thank you so much for sharing your insights on the journey to building your practice, on the art of functional medicine, and what it means to be excellent. If somebody wants to learn more about you, where can they find some info?
So my website, which is currently being updated and improved, but has terrific content on it, is www.drshawnaltman.com. And there's some good resources on there in terms of the treatment approach I do, a lot of the treatment methods. And then my contact information is on there as well. And yeah, for anyone who's interested in learning more, I am more than happy to do that. My goal at this point in my career, in addition to clinical excellence, is education. I really want to get this information out there, especially to young minds, especially to people learning medicine who are really excited about becoming more advanced and proficient. Because you and your fellow students, you're the future of medicine. And if we can get more people on board with looking at the big picture, functional medicine, longevity medicine, like that's really what I do, in a nutshell, then that could change the way medicine is practiced. But it takes a lot of people and a big movement for anything to change in medicine. So, I'm hoping I can be part of the spark that lights that fire. But then in order for that fire to burn, in order for things to change, there's going to have to be a lot of people who start doing this, and more publicity, more recognition in order for it to be successful. So I hope you and many others can help me in this journey to help people more meaningfully, to really fill those gaps in the system that exist.
Absolutely. Thank you, sir. It takes a spark to light an inferno. Folks, we've been talking to Dr. Sean Altman. Dr. Altman, thank you so much.
Thank you.